We're here this morning to talk about what was the top issue for Minnesotans on the campaign trail, and that is health care. 350,000 Minnesotans are currently uninsured, but thousands more struggle with the fear of losing coverage that they have through employer-based coverage, and others have coverage that they can barely afford with high deductibles and high premiums. This is putting Minnesota's economy in the slow lane because many Minnesotans won't leave their current employment to start a new business or make a change in their career because they're afraid of losing health care. Republicans are threatening to put health care for Minnesotans at risk. Women's health care is under attack, and Minnesotans are struggling to deal with the rapidly increasing costs of prescription drugs. This is unacceptable. We believe that all Minnesotans deserve access to high quality and affordable health care. Our budget works to ensure every Minnesotan can afford their health insurance and actually get the care they need when they need it. Instead of giving money to insurance companies with no strings attached, we'll implement health insurance discounts that go directly to consumers. And we also will provide a pathway to a public health care option. We're going to secure the Health Care Access Fund, and in doing that, protect health care for more than 1 million Minnesotans. We're going to protect women's access to health care and ensure that women's health care decisions are between them and their doctors, not them and their employers, and not them and politicians. And we're going to work to reduce the cost of prescription drugs because Minnesotans shouldn't risk losing their lives because they can't afford something as simple as insulin. We're ready to make health care more affordable, and we look forward to working with Republicans to try to get a deal we can all support at the end of session.
Good morning. It will be a challenge to put together the deal that will actually serve Minnesotans this year because Republicans stand on the side of big insurance companies and big pharmaceutical companies, while we are fighting hard to stand on the side of ordinary Minnesotans. The Republicans' only health care plan is to give hundreds of millions of dollars in unsustainable giveaways to insurance companies in the hopes that those insurance giveaways will lower premiums. Just this week, health plans announced that they're doing just fine. They don't need any taxpayer handouts again. At the federal level, we see the Trump administration and Republicans once again attacking the Affordable Care Act and trying to roll back basic protections for Americans, which are not only necessary to protect people's lives, but are wildly popular with the public. DFLers are working to make quality, affordable health care accessible and available to everyone. We are working to put Minnesotans ahead of special interests.
Good morning. I'm State Representative Tina Liebling from Rochester. I'm the chair of the Health and Human Services Finance Division in the House. And I'm very pleased to be here to just discuss at a high level some of the important provisions that are in the Health and Human Services Finance Division bill. So first of all, I know you're all aware, we include in our bill the repeal of the sunset of the provider tax. It is so critical to the future of our state and our ability to continue to innovate in healthcare, in addition to maintaining coverage for over 1 million Minnesotans. But the Health Care Access Fund, as everyone knows, also provides for health, for better health for all of Minnesota. It is critically important. It has helped us have better health as a population, and we'll continue to do that if we keep that fund. We also have pieces in the bill that I know you've heard about that come from the governor's One Care program, including affordability pieces for people who are buying their insurance in the individual market. This is only about 155,000 Minnesotans, but those people are really finding it very difficult to stay covered. And as the speaker noted, even people who have insurance are finding they don't have access to health care because of the high out-of-pockets. So we have pieces in there that help people afford to buy insurance, and a product that will come online in a few years under this plan that will provide an option with much lower out-of-pockets, thereby allowing people to have access to real care, not just something they can call coverage. There's a proposal in our bill also that holds insurance companies to the promise that when you buy their policy, you actually will have access to care. This is something that technically is called network adequacy. We are improving it in this bill. It's basically regulation that ensures that when they sell you a policy, you can actually get the care that is promised to you under that policy. One of the really important things I want to mention that is in our bill is the first increase in cash assistance to families on our MFIP program, the first increase in 33 years. This is really important. I think it is a bipartisan shared interest. But when you think about the fact that families on our family investment program, a family that was on the program 33 years ago would today be getting, would have gotten then the same cash assistance a family would be getting now, and having to live on that amount of money, that's pretty shocking. And so we're really proud to be able to change this because it impacts the lives of many, many children in our state. So we have a lot of bipartisan bills in our omnibus bill. We believe that this bill will do a lot of things for Minnesotans. It will lower prescription drug costs for all Minnesotans eventually, not just for our public programs. This is extremely important to us because, as the speaker noted, Minnesotans are struggling with higher and higher prescription drug costs, and that is a big piece of escalating healthcare costs in our state. We're lowering the cost of healthcare in other ways as well. We have provisions to help reduce health disparities in the state so that more of our people can get a good chance to live a full life. We especially want to improve, and maybe Representative Moran will speak to this, but child protection services to try to reduce trauma for children and give more children in our state a better chance at a full life. Other things, women's health, the speaker mentioned. We have increasing access to birth control. We have improvement of breast cancer screenings. We have some pieces to really, for the first time, have to try to prevent sexual assault and domestic violence, and even more. It's a hard bill to talk about because it covers so many wonderful things, and we're really excited. Of course, no bill solves all problems, but this one makes a darn good start on improving healthcare for Minnesotans. Thank you.
Good morning, everyone. My name is Rena Moran. I represent District 65A here in St. Paul, and I am also the chair of Health and Human Service Policy, and just really excited about the healthcare bill. And within my committee was able to hear over 138 bills that came through that body, for you to get an idea of what the people in the state of Minnesota are wanting to hear and the solutions that we need to do to make sure that we are creating more fair and equitable outcomes for the families around the state of Minnesota. Within this bill, you definitely will see some policies and practices around ensuring that we are keeping kids safe in their homes, but also supporting kinship care, creating a pathway for reestablishment of parental rights. I think that's a good place for us to be, as we know that when we look at healthcare is more of a holistic, comprehensive approach about creating outcomes, not only in healthcare, but within our educational system, within the workforce, but also back in our communities. So as we look at the bills that are in healthcare, we look at the doulas. We know that doulas have not been reimbursed at the same rate. We look at birth rates. That is really, really important within the African-American community as we look at low birth rates and low death of infants. We are solving that problem within this bill today during this session. So my hope is we continue to look at how we create access for health care for everyone across the state of Minnesota, that we're also looking at the impacts and disparities that are facing so many communities of color across the state of Minnesota. Thank you.
So my name's Jen Schultz. I've been the chair of the Long-Term Care Division. I represent Duluth in District 7A. And, you know, we continue to hear a lot of reports of older and vulnerable adults being victims of shameful behavior at the hands of the very people entrusted to care for them. And Minnesotans should be able to live with dignity, and there's protections in this bill to protect elders and to prevent abuse and keep them safe, because all Minnesotans want to make sure that their loved ones are safe and being cared for with the best, highest quality care. And there are protections in this bill to do that. This bill ultimately is about accountability, holding health insurers and providers accountable to provide high-quality care at prices that Minnesotans can afford. It invests ultimately in improving population health, as Representative Moran just spoke about, investing in improving infant mortality rates and child health, investing early on to get the best population health outcomes in the long run. So having a positive budget target and creating hundreds of pages in a bill, and every page is important to improving that population health of loved ones. There's also language in the bill to guide conversions when HMOs want to convert from a nonprofit to a for-profit status. We work closely with the Attorney General's Office, the Department of Commerce, to come up with language to guide those conversions when they happen. There's also language to put limits on excess revenue of health plans by making sure that they're following medical loss ratios of 80 to 85%. So 80 to 85 cents of every premium dollar should be going to spending on health care claims or medical care. As you saw, large profits or excess revenue of our health plans, we need to make sure that that money is going rebated back to the citizens of Minnesota or being spent on medical care. So I think we're happy to take questions at this time.
This thing is really 998 pages long.
Well, I believe 200 of those pages are the elder care bill.
All of them important.
All of them important.
Has everything in this bill been at least heard in this committee?
I believe everything has been heard in committee, multiple committees.
Well, you know, in every omnibus bill, let me just say this, there are some small pieces that have not been heard as separate bills, but the process is such that if it's in the omnibus bill, it will be heard before it goes out of committee. So let's just put it that way. We are not sneaking things in the dead of night. We are about transparency. So in this case, you know, the size of the bill is, the size is somewhat arbitrary. This is a bill that does so many good things for Minnesotans that I think in this case, it is really legitimate to say that size does not matter.
But you say they will be heard. Does that mean you'll have a hearing on the omnibus bill, and if someone wants to talk about something on page 627, they can? Or that you will make an effort to highlight the things in this bill that have not yet been heard and notify people so that then they have the opportunity to comment on them?
Yes, we have, well, both. We have done that. We had a walkthrough of the bill yesterday in committee, and the staff highlighted the things that have not actually been given a hearing, and they're really very few. But this is always the process. We are in committee. The committee is where things can be introduced and discussed and worked on. We will have a process where we're going to continue taking public testimony today, and then members will have an opportunity to take what they heard and write further amendments. And then Friday all day, or part of the day Friday and perhaps part of the day on Saturday, we will be taking amendments, discussing amendments, anything that, if a member of the public goes to a member of our committee and says, I want you to bring up this topic and we need to talk about more about that, we will be doing it. We're allocating a lot of time to that. And we intend to have this be, it's a very well-vetted bill even right now. It will be even more vetted by the time it leaves committee. That is our commitment. And it still has a few stops in committee after this, by the way.
And you'll pass your committee by the end of the day Saturday?
Yeah, I mean, by the end of the day, Saturday. I mean, of course, it all depends on how many amendments are submitted, how much members want to talk, and we will have a free and open discussion about any topic in the bill that members want to discuss. And our intention is to pass this bill by the end of Saturday. Out of our committee, it will go to Ways and Means. From there, the intention is it will go to the Tax Committee. So the bill has a number of stops before it goes to the floor.
How does this compare to the size of other health and human services bills? I remember the speaker years ago having a 600-page bill he said he had to read. Is this the biggest?
Well, I think, you know, obviously in the last year, we had Omnibus Prime, but remember, Omnibus Prime was a supplemental budget, and it contained budget items all across the spectrum. So It really, year to year, it changes depending on whether there's an omnibus policy bill in addition, whether a large policy changes go separately or in the bill. So I don't know if this is the largest, but I kind of think that what really matters is that we are carrying large things like this vulnerable adults bill, which, mind you, is left over from last year. This is work Republicans did not accomplish. So this year, we not only have our work to do, we have cleanup work that the Republicans failed to get done because, as you know, they put all their eggs in one basket and then they drop the basket. So we've got to find some new eggs and put them back in.
Stop with that metaphor, don't continue with it.
Yeah. No, I think it's important to differentiate the Health and Human Services bill from Omnibus Prime, right? We're talking 990 pages in both. We always have omnibus finance bills. This bill pertains to Health and Human Services. It does not pertain to Health and Human Services and the environment and taxes and the kitchen sink. So that is the difference. And the Health and Human Services bill is almost always the biggest, and the debate is almost always the longest. So you can expect a floor debate of anywhere from 6 to 12 or more hours in a typical year. It's a wrenching topic. You know, we, in the legislature, we jokingly refer to this committee as hell and human sacrifice because of the service that members do on this committee. People come in and they tell their most heart-wrenching stories of healthcare that was not delivered to a loved one that caused a loss of life, and the difficulties they're having providing healthcare for their families. And there's a lot of Minnesotans' hopes and dreams tied up in having healthcare they can count on, and that partly is reflected in the size of the bill and the number of hours we will spend debating the bill.
And almost all, at least all the major policy issues will be in the bill? Or will there be a lot of separate bills too?
Well, I have advocated to Senator Gazelka that we send as many other topics on their own as we can. We are sending opioids on its own. That's something that customarily could travel in the finance bill or on its own. We're very pleased that that's in conference now. And Representative Schultz is carrying the vulnerable adults provisions and has been working phenomenally with Senator Housley on that. Hopefully that 200 pages will become unnecessary in the omnibus as Representative Schultz and Senator Housley continue to work. I don't know if you want to say anything about that.
Can I just throw something else in? I think you'll see that the House is moving forward with a lot of ambitious legislation this year, and the Senate is not. And in order to have us continue these conversations, that means our omnibus bills have to come with all of the plans that we have to improve the lives of Minnesotans contained in them. And that's how we will negotiate it out. That's maybe not the best approach that we would prefer, but we have to have a negotiating partner on the other side. And the only way we can ensure we have a negotiating partner among Senate Republicans is to have items in the omnibus bills.
Who can speak to drugs?
Which kind?
Again, we can't tell, and so I'm going to ask you to tell me, is say the Morrison transparency language, is the pharmacy benefit manager language, is the Lesh gouging language all in this bill somewhere?
Yes, they are. We have a really great package of bills that, by different authors, that are all intended to the same goal, and that is bringing down the cost of pharmaceuticals for Minnesotans. And the pharmacy benefit manager language is also a bill that could also track separately. So, you know, there are, I think, as the majority leader mentioned, you know, there are some things in here that, in fact, could go separately. They may still go separately, and it's very common to have bills in two places or more places, even.
But saying stuff's common does not mesh with the leadership's pledge to do things differently this year and be more transparent this year. So how things used to be done isn't as good an excuse this year.
There are ways that the legislature works, though, that make sense, right? We have a belt and suspenders approach to important legislation, like dealing with vulnerable adults. If the Senate fails to pass a standalone bill and send something to conference, we cannot not have that conversation. So the reason why in the legislature proposals often travel in many different places is to secure their survival through the end of the legislative session. What is different this year is that we are doing our work in public. What is different this year is we are pushing the Senate over and over and over again to bring these conversations into the public that used to be behind closed doors. Our conference committee chairs will have real authority to negotiate these agreements. And we have a commitment from the Senate to come up with budget targets that we give to the conference committee chairs. Over the last 4 years, what you've seen is Republican leadership in the House drag as much as they can to the highest level of decision-making and drag as much as they can behind closed doors. We are doing the opposite. We are pushing as much as we can into the sunlight and into the committee process.
Time for one more question.
Will this bill pretty much solve all the problems the elder care industry has faced that we've been reporting on over the last couple of years?
Yeah, it solves the problem of funding to address abuse, to follow up with claims and investigate those claims of neglect or other maltreatment in the assisted living facilities. It provides a licensure. Minnesota is the only state that does not license assisted living facilities, so it provides definitions of what an assisted living facility is. It includes prohibition on deceptive marketing that may be misleading, aggressive marketing practices. It protects residents from retaliation, and it clarifies residents' civil rights. So there's really some enforcement mechanism that it's protecting their rights as citizens. And this is what we're hearing from the advocates, from those with loved ones who experienced maltreatment and abuse.
Is there some way that someone, say like me, could figure out what's in 998 pages? Do you have a section by section? Do you have a list of bills that are included? Is there something other than talking points that we could see that gives us that?
In committee, there's been distributed by article, what's in each article. And so it's, in an omnibus bill, it doesn't read like a book. And there's the one bill maybe in various parts of the bill. He can give that to you.
We can give you as much detail as you would ever want and as much time as you could ever want to study it.
And it's on the committee webpage.
Yes. Thank you.
Thanks.
Thank you.